Welcome to our presentation about the athletic training education competencies. If you haven't downloaded the document, please do. I do want you to read this document. You'll use this document in completing the choice signature assignment when you create your lesson plan. So this is a critical document for that particular assignment. What this document is about is it provides professional education program directors, clinical competency, and other faculty members with the knowledge and skills and clinical abilities that athletic training students should master by the time they finish the program. As you can see, that this is the 5th edition, so that means there were 4 other editions before this. And this was released in 2011 by the NATA. And it's in the 4th edition, there were 12 content areas. Now we have 8 content areas. And so in the 8 content areas, these are the areas that athletic training students, by the time they complete their academic program, again, should master these 8 content areas. What we are saying when a student finishes a program is that the student meets the minimum requirement in these particular areas where they can provide athletic training services to patients. They have the academic educational background to do that. And that's the minimum requirement. So we have content areas that are made up of, I'll talk about that in just a bit. So I'll get down to the breakdown of our content area and our clinical integrated proficiencies. As you can see in those 8 content areas, we have evidence-based practice. That's pretty new for us as athletic trainers. I'm not sure how many of us actually use evidence-based practice. I hope more of us do. In the assignment on evidence-based practice, you'll be given really good information about how to do that. Some of you who are newer athletic training professionals who have just finished your athletic training programs probably know more about evidence-based practice than some of us older dogs in the athletic training area. In these other areas, you can read through them. They have combined quite a few of the areas from the 4th competencies, and you can read that in your document. In the document itself, on pages 9 and 10, it talks about our foundational behaviors of professional practice. These are pretty straightforward. I'm not going to spend a lot of time on them. I just wanted to highlight these things. Obviously, our patients should be the number one and most important thing, and taking care of them the correct way. Other part is our team approach to practice. Realize that we don't practice in a vacuum. We should involve as many appropriate other medical professionals into our the way we practice and take care of patients. That includes parents if you're at the high school level, and even sometimes at the college level. And so that includes having physical therapists, chiropractors, so forth and so on. And it also depends on what state you work on and what you're allowed to do, that which goes into legal practice. You have to work within your scope of practice. And then we'll spend time discussing some of these issues, the legal practice, ethical, and those type of things in the practicum courses, or the students who have completed or towards the end of completing this program. You already have discussed some of these things in the practicum courses. That's talking about our BOC standards of practice, professional practice, and the BOC code of, or NATA code of ethics. Advancing knowledge is, we want to continue to get better at what we're doing, but it needs to be based on good quality research that's evidence-based. Cultural competence is pretty straightforward. We want to be sensitive and know that people do things a little bit different than everybody else. Don't assume that all of us are the same. Professionalism, that's a hard word for me to say right now, is how do others see us out there? We should be an advocate for our own profession. And that was one of the reasons why I was talking about in a previous presentation about using the term athletic trainer versus trainer and athletic training room versus training room. The only way we are going to change our profession is if we start making those changes ourselves. All right, so if we look at our document, that we'll see that in the 8 different content areas, there's expected outcomes. These are the outcomes that we, as if we were pretending that all of us were faculty members at a professional education program, we would need to design our curriculum around the 8 content areas. And within the content areas, students, it's focused on knowledge and skills. Knowledge is obviously, in other areas we would call that the cognitive domain, which would be the mental domain, like a thought, being able to understand information, and then skills. In the PE side, we will call that psychomotor. That's the actual doing of it. So the knowledge would be, I know about the anatomy and physiology of our body. I know where our ligaments are. And then this, for an ankle, for example, I know that I have lateral ligaments that can be sprained on a certain range of motion or exceed that range of motion when I step on somebody's foot and invert my ankle. And then the skill is, one could be taping an ankle, can be doing anterior drawer test, all those different skills that we need to know. So I just picked one that's on page 13 of the document, and this is the prevent and health promotion. And so that's the first one. Describe the concepts. Okay, describe is a verb. It's an action verb. We'll talk about learning objectives, I think next week. That's for knowledge. Describe the concepts. For example, case definitions, incident versus prevalence, exposure, assessment rates, and uses of injury and illness surveillance relevant to athletic training. So somewhere in our curriculum, we have to make sure that that knowledge area is being taught in at least one area in a course. And if you choose to do the signature assignment where you pick one of the different athletic training teaching and learning topics, one of the topics is learning over time. And one of the things we know in learning over time is that we can't just assume a student's going to learn something if you expose it to them once. So we would want to expose it to all these things to a student, both in a clinical, in a teaching setting, in a classroom setting, and maybe in a laboratory setting, and in a clinical setting. So again, in the signature choice assignment, each student's going to pick one content area. So we have these content areas. So you can choose any one of those 8 content areas for that particular assignment. And then you're going to then pick one of the expected outcomes in that content area to develop a lesson to meet that particular knowledge and or skills for that area, that content area. Again, you'll develop a lesson to teach that for a pretend class. And again, you have the choice to do that lesson for the actual face-to-face normal class. If you want to do it online, that's fine. Pretend it's online. Or in a laboratory setting or in a clinical setting. Now, if you're going to do a clinical setting, we have the clinical integration proficiencies. And in the Katie document, what these CIPs mean, that they represent the synthesis and integration of knowledge, skills, and clinical decision making into actual client patient care. So these are the things that we actually do hands-on with our patients. In the Competencies document, it actually says that these clinical integration proficiencies should actually be done on an actual patient. So we should be doing these. So I picked one from page 32, and there's a mistake. There's a citation mistake on that particular citation from the NATA. I did not provide quotation marks, so I should have provided quotation marks around the CI, starting with CIP, and ended those quotation marks at activity. And then there's another citation error in the very first bullet point. I forgot to end the quotation after the word care. So those are the type of things that I would nitpick on you about. So I'm nitpicking on myself about that. So anyways, sorry, went off on a tangent. So this particular clinical integration proficiency, select, apply, evaluate, and modify. Well, it's a lot right there. Appropriate standard protective equipment, taping, wrapping, bracing, padding, and other customer devices for the client patient in order to prevent and or maximize the risk of injury to the head, torso, spine, extremities for safe participation in sport or other physical activity. Now that's a ton of stuff right there. If you would pick this particular like clinical integration proficiency, I would narrow that down. When we talk about learning objectives, there's like a ton of learning objectives in there. I would pick it. You can probably use the select, apply, evaluate, modify, and maybe just pick one of the standard protective equipment, taping or bracing, blah, blah, blah. Just one of those for a specific injury. It'll be a lot easier for your lesson plan for this particular class. And what this is trying to do is trying to integrate multiple different things. So we're not just listing ankle injuries for ACL, MCL, blah, blah, blah. That gets pretty tedious as far as a large document like this. But in a class like care and prevention, this would be one of the proficiencies that can be done in the clinical setting. Hopefully, by the time a student's done, they can, with the program, they should be able to do this. I mean, it's very practical that a student should be able to do this when they're done with their clinical setting. Now we're going to move on to the standards for developing a CATIE professional program, both at the entry level and at the post-professional level. The standards that an academic program needs to follow in order to become an accredited program through CATIE.